Okay. What is the most likely diagnosis? Ooh, okay. A 25-year-old man presents with a painless, firm mass on the left testicle that he noticed a few weeks ago. On examination, the mass is confined to the testis and does not transilluminate. Blood tests reveal levels of AFP and HCG, elevated level. An orchiectomy is performed, and histopathological examination shows a malignant tumor with immature, undifferentiated, resembling primitive embryonic tissue. Okay. Which of the following is the most likely? What is the most likely diagnosis? Man, oh man, oh man, I'm so bad at these. Um, so when I see AFP and HCG, I'm thinking,
So I guess just to kind of gear you towards the right thing here, what
yeah,
what sentence, I guess, is the best way to phrase it. What sentence or piece of evidence that they give you is most specific?
the malignant tumor with immature, undifferentiated cells resembling primitive embryonic tissue.
Yeah, because that's the biopsy, right? And so in
Yeah,
your mind,
biopsy.
your answer choice has to in
Match
you
that.
know have to match that, right? Of course, sometimes they give you it, and you're like, I don't know what that is. But do you think you can use that to your advantage, the most specific thing?
Uh, I mean, I think I just need to review these flat out. When I see primitive embryonic tissue, I always think teratoma. Always, always, always. I just don't know why I get that, but I always think teratoma. Um, but I don't know if I don't think they're malignant, is what I'm thinking.
Okay.
Um, and then I know seminoma is the most common embryonic carcinoma. I guess I can just go with carcinoma since it's a malignant, like that's a malignant name, and I don't
Okay.
know. I
Final
would
answer.
probably say that.
Yeah, embryonal, right? Because it says embryonic tissue,
Oh,
right?
that's
So
crazy. Yeah, that's crazy.
sometimes the thing that's most obvious is going to be the answer, right? And so remember, you have your Sertoli Leydig cell tumors that will secrete like testosterone, doesn't give you too much of that. Teratoma, right? Remember, teratoma usually they say that for the most part, histology is going to show three different cell lines, right? Your epithelial, endothelial, etc., right? So which is why you get like
Mm,
teeth and
hair.
hair and all that stuff in there is because it has developed different cell layers within the same tumor. Teratomas, for the most part, I would say most part is benign. They can be malignant, just so you know. Very rare, but they are usually benign. But they will tell you that, oh yeah, you have three different cell layers here, right? Mesenchymal and whatnot, right? So you have your muscle layers, your epithelial, and then inside like gut stuff. So you'll have all that stuff in there. So unlikely teratoma here.